Welcome back. A nationwide shortage of COVID-19 test kits is leaving an impact on Wisconsin hospitals and who they can treat.
Well, that means some patients are able to get tested for coronavirus while others cannot. Leah Linscheid found out how your healthcare provider is making that decision.
There's this old saying I've been thinking of lately.
You know, this is going to sound super cliche, but
maybe you've heard of it.
I got into nursing to help people.
It goes something like this. During hard times and challenges, when the only thing that's certain is the uncertainty ahead, try to look for the helpers.
I love when we have the success stories.
We found two of them, these days called Essential. One, a nurse. Her name is Sydney.
You know, where you worked with someone when they're intubated and super sick, and then they're going home and they're healthy and they feel good.
He works for UPS
and a delivery driver, Hayden.
He's just he's a super guy.
Both 24 years old, both continuing to work through the worry, and both looking for help themselves.
When I first became symptomatic, it was a sore throat, a little bit of a dry cough.
Sydney thinks she caught COVID-19 a couple of weeks ago after a shift at the hospital.
And I thought to myself, well, maybe I just have a cold, maybe allergies. Of course, COVID came to mind, but that's the last thing that you want to believe that you have.
When she couldn't shake it, she talked to her doctor and got tested immediately.
It took anywhere from 36 to 48 hours to get my results back. And of course, they were positive.
To our other helper, Hayden, he also had symptoms.
Achy, sore, coughing is one of the major ones.
His started a month ago, but he still isn't feeling well enough to talk to us.
But it was just a persistent cough.
So Mom Michelle shared his story.
And he was coughing so much that his, rib cages were hurting.
Hayden's experience was very different from Sydney's.
And that's what's so disconcerting to us, because we've talked to 3 different triage nurses and they will not test him.
2 essential workers, the same age with similar symptoms. What's the difference?
In the ideal world, you test everyone.
Lisa Schnedler is the CEO of Upland Hills Health in Dodgeville. She says a testing shortage has hospitals statewide making hard decisions about who gets tested and who doesn't.
That is the biggest problem we have right now. We're down to 147 test kits. We have to be very judicious about who gets a test, and that's not how you are supposed to handle a pandemic.
This is a collection kit that's used for the COVID testing.
It's not just Wisconsin looking for these tests. The state's Department of Health Services says the national supply chain is fragile, and because of that, it's implemented a 4-tiered system to prioritize who gets tested first. Here's what that looks like. Tier 1 includes hospitalized patients who are critically ill and have symptoms of COVID-19. Tier 2 mainly covers healthcare workers with symptoms, like our helper, Sydney. Tiers 3 and 4 cover people in the community with varying degrees of symptoms and underlying medical conditions. Right now, state labs are only processing tests from Tier 1 and Tier 2 patients, and hospitals won't even test people with mild symptoms. Here's what that means for Hayden and for the rest of us.
So you would call into your doctor right now and you don't have other health factors, but you're saying, I have a dry cough, I have a fever, but they won't be giving you a test for that at this point, because we simply have to hold those for the more critical and more acute patients.
Back to our helpers.
I'm a little sore, a little achy, but
Sydney's symptoms are clearing up.
I'm very grateful that I had what is considered a mild case.
Hayden still hasn't been tested for COVID-19.
It's the fear of the unknown.
Instead, he's been diagnosed with bronchitis and is still recovering in bed. Still, hope is on the horizon for both Hayden and Sydney, planning to be back up on their feet and helping the rest of us as soon as possible.
It feels good.
For News 3 Now, this is Leah Linscheid. Stay well, everyone.
Upland Hills is hoping to get more test kits in soon. They've had shipments ordered for the past month, but there's no clear timeline on when they'll arrive.